Welcome to Voices of the Front Lines. Over the past 25 years, the surge in drug overdose deaths has escalated into a national crisis, affecting urban, suburban, and rural communities. Between 1999 and 2023, overdose deaths soared by an astonishing 520%. In 2024, 80,400 lives were tragically lost to drug overdoses in the U.S., a staggering number, yet a 27% decline from the previous year. Stark disparities persist, particularly in Black and brown neighborhoods. While overdose deaths decrease nationally from record highs, Black communities are not experiencing the same progress. In some areas, overdose deaths continue to rise, underscoring an urgent need for harm reduction strategies and resources that can fortify the individuals and organizations on the front lines. This epidemic is ravaging under-resourced communities, including Milwaukee's North Side, where overdose deaths remain a persistent tragedy. In Milwaukee County, 450 people lost their lives to overdoses in 2024. On the front lines of the fight to save lives is Samad's House, a vital community resource offering credentialed day treatment, intensive outpatient services, and harm reduction tools like naloxone and fentanyl test strips. Through educational workshops on substance use disorders and mental health, Samad's House empowers women to achieve lasting sobriety, rebuild their families, and reintegrate into society with dignity. By combining harm reduction strategies with mental health support, they help women make safer choices while honoring their autonomy. This podcast is dedicated to amplifying the voices of those on the front lines, street outreach workers, peer support specialists, and harm reduction advocates. Together, they'll share their challenges, triumphs, and the real-world impact of harm reduction in our communities. Each episode will spotlight personal stories, pivotal events, and the urgent need for equitable funding from the government, the private sector, and philanthropic organizations to support programs like Samad's House. These programs provide the tools and opportunities for individuals to recover, thrive, and create their own success stories. Our host, Tahira Malik, the founder of Samad's House, is a survivor of substance use disorders herself. Today, she is a role model for women on a recovery journey. Through her leadership at Samad's House, she offers a place to stay and a foundation for women who want to rebuild their lives and reclaim their futures. Let's dive into the stories, solutions, and hope that fuel the fight against overdose deaths. Welcome to Voices of the Front Lines.
Hi, I'm Tahira Malik, founder of Samad's House, and this is Voices of the Frontline podcast. Today, we are pleased to acknowledge that the overall number of overdose deaths is dropping in Milwaukee, Wisconsin, and across the nation. But the decline is not as sharp in Black and brown communities. Drug overdose deaths continue to ravage our families and our communities. I'm joined here today with a group of people devoted to saving lives. Today, we will elevate the voices of people using harm reduction approaches to save lives, reduce drug stigma, educate the public, and forge policies to keep our users and communities safe. Together, we are launching the Midwest Regional Black and Brown Harm Reduction Network to preserve the progress and move forward with initiatives that create healthy families and communities. I'm going to let our panel introduce themselves and tell us about their work. Let's start with Connie.
Hi, Tira. Good morning, everybody. Thank you so much for inviting me to be on the podcast. I'm really excited to be part of this. My name is Connie Calderon. I'm the Director of Recovery and Peer Support Services with the Milwaukee Turners. I oversee 3 programs, our peer support program, our recovery programming, and then also our harm reduction programs. So we work with the communities, under-resourced communities in Milwaukee, assisting them and supporting them through their needs, whatever they may be, meeting them where they're at, with either harm reduction or recovery resources. The Milwaukee Turners is 173 years old. We are a civic liberties nonpartisan nonprofit in Milwaukee, one of the oldest ones. And so we're proud to say that all of the work that we do here is focused on helping the communities in Milwaukee and the underlying communities as well. We got started in the harm reduction recovery programming about 3 years ago. I assisted in starting up the programs with certified peer support specialists, working with people with substance use disorders and mental health concerns. And then we moved forward with getting a harm reduction vending machine in the building, and then beginning to work with Milwaukee County Prevention Team on doing various events and work right in the front lines.
Well, thank you, Connie. We appreciate you taking time out of your day today to join us for this conversation. We'll go over and we'll start with you, Caroline. Please introduce yourself.
Yes, good afternoon, everyone. I'm Caroline Gaston. I am a Chief Ambassador for Harm Reduction of Samad's House. I joined the program as a Bridge House member and I was invited out to the community to do harm reduction one day, outreach. And from that point forward, I felt that I had something to offer, found my purpose in saving lives through harm reduction. And I go out every Monday in the community in targeted areas where there's high profile and drug related activities and distribute and train on Narcan and other harm reduction associated materials and resources that we give out. It's been a very rewarding experience for me. And I must say that I had the experience, through lived experience, where I accidentally had an encounter with some fentanyl accidentally. And it was through someone that had access to Narcan. And that's what saved my life. And the evidence has produced itself in our mission on many occasions where we had to actually Narcan some people in the community that we saw that was going through a fatal overdose. And through the grace of Narcan, that saved their life. Thank you.
Thank you, Carolyn, for being here today. And thank you for working so diligently on the front lines. And we have Amanda De Leon. Thank you, Amanda, for joining us today. Please introduce yourself.
Oh, I'm so excited and blessed that you guys asked me to join in on this podcast today. My name is Amanda De Leon. I work for Community Medical Services as their Regional Community Impact Manager. I know that's a lot to unpack. So basically what that just entails is going out and educating folks on MOUD treatment, which is medications for opiate use disorder. We're a clinic that strongly believes in intakes on demand, and we want to bridge those gaps for our patients and work with individuals in the community so our folks have access to services. So in my role, I get to do all the fun things and go interact with all the lovely ladies on this call today, as well as, politicians, fire chiefs, police chiefs, all of the other things, so we can bridge those gaps and better help our individuals out here using drugs. And also, more importantly, to reduce that stigma that's attached to people who use drugs. That's the number one reason why people don't get help, is because of that stigma, or people don't understand addiction as a whole. So my role is to go out here and educate folks and just plant some seeds so they understand why folks are out here using substances.
Thank you for being here, and thank you for the work that you do. So let's begin. Let's jump straight into our discussion. What harm reduction services do you feel have made the biggest difference in your life or someone you know life?
I would say, being on the front lines, I think the biggest impact is just having access to naloxone. When I first started in this world 20 years ago, we didn't have access to that. And harm reduction, what is that? Treatment was punitive, all of the things. So there's a lot of different things that have happened. We got around this idea of harm reduction, giving people the supplies they need to use safely, but most importantly, giving people access to naloxone, and then also providing the education about naloxone. There was so much stigma attached to even taking a box of naloxone. When we'd be out there doing the trainings, they'd be like, I don't want it, right? And especially at a crime and safety meeting. And you know, you don't want to be, oh, Sally grabbed that box of naloxone. What's going on over at Sally's house, right? So what we decided to do is took that away from them. And what we did is instead of telling them, hey, this is here for you, we just gave everyone a kit, right? Because then they had it and they didn't have to, you know, feel that pressure of, oh, what's Tahira going to think of me if I grab this naloxone, right? So it allowed them that a little bit of freedom and anonymity to grab that.
And I agree with you, Amanda, because I remember when Samad's House first started venturing into harm reduction because we were tired of losing our loved ones and our friends to fatal drug overdose. I reached out and you were one of the first people to respond. And you came to our very first Black Balloon Day, which is a national day of awareness for people who've lost their lives to drug overdose or their families to drug overdose. And you came in and you trained a room full of people at Samad's house on the importance of using naloxone. But not only did you train on how to use it, you trained on what to look for. You know, because a lot of times people didn't know that someone was overdosing. They thought they were just asleep, you know. They didn't know that they were actually losing air, you know, their respiratory system was slowing down, and you trained on that. And I do remember you brought boxes and boxes of naloxone, and then it became scarce. It was like everyone stopped, you know, so. Yeah, I always share that story because you were one of the first people to not only train me, but teach us on the importance of why we needed to put it out in our communities. And when we started the community collective, people didn't want to take the boxes, even though we were in central Milwaukee, you know, in the most disproportionate neighborhood, people didn't want that stigma around them, you know, and you're right, absolutely about that. Connie, what about you? What harm reduction services do you feel made the biggest difference in your life or someone like that you know?
I think for me, of course, all of the things Amanda said, you know, like ditto. That's a huge thing. You know, even since we started here, the Narcan, you talk about the scarcity. I remember for our first Narcan training that we held here at Turner's to introduce the actual machine that we got, I had to like go searching for places just to get like 3 boxes or 2 boxes to cover the people that came to our training. And so now it's so nice to be able to have like plenty of it that we aren't worried about like hoarding it because we're so worried we're going to run out. So it's nice to be able to call on, you know, especially you two, Tahira and Amanda. I definitely are my first calls when I'm like, hey, I need more strips. But I would say for me, like the most eye-opening thing and the thing that I like to, I don't want to say push for lack of better terms, but encourage people to learn about is the testing strips.
Oh yeah.
Because in my life, there's more people that use recreational drugs and they don't realize that the testing strips are things that they can use on all different kinds of drugs and even alcohol, you know, drinks that you can use the different testing strips in. And so educating people on the ability to be understanding of like, hey, you might use this recreationally, not judging you, like whatever you decide to do with your life is what you use to do. But please be aware that even if you trust the person you're getting them from, or you think you know them, or they're your cousin, like this is very important to do. And then opening people's eyes to the fact that just because you have a Narcan on you, you don't have to know a drug user to even have it on you. It could be your neighbor's 16-year-old granddaughter getting into her pills, you know, like, or a baby even like accidentally getting into their pills. So I would say like eye-opening for the people mostly is the medication destruction bags, you know, and then also the test strips.
So Connie, when you say the testing strips for our viewers, everyone may not have the background knowledge like we do about what testing strips are. So can you educate on that?
Yeah, so there's testing strips, and right now, to my awareness, unless there's something more, there's 2 different types. One is to test for fentanyl specifically, and they come in these little packages. You can get them from any of us, and also at any harm reduction vending machine that's near you, which is all over the county. And then there's also xylazine and fentanyl testing strips, and xylazine has become more prevalent in drugs, street drugs and recreational, drugs, whatever substances, you can think of. Unfortunately, they're slipped into just about everything. And so xylazine has become more prevalent. Both of those are used as, ways to find out that if the drugs you're using contain either of those things. And then if they do, you definitely want to make a sound decision to not then use that supply of drugs that you might have. Because as we know, there you go. Because as we know, like even a grain of it, small grain of salt, I like to say, or even, the smallest amount that you can possibly think of can be fatal.
Absolutely. When we say fentanyl is a synthetic opioid, that has been tainting the drug supply. And a couple of years ago, that was responsible for 80% of the fatal drug overdose deaths here in Milwaukee County. And xylazine is a horse tranquilizer that they're putting on drugs, and it's just as fatal as fentanyl. And Amanda, thank you for holding up the test strips. Can you go again and show our viewers exactly what they look like?
So this is one from a Maury Hope kit. So you guys might see some of these out there. But inside here, it has from the Milwaukee Health Department instructions on how to use it. And then this little white thing in here is the test strip. And then these are just, cups that people can use to test their substances in. And then the solution as well, because we want to make sure that they're testing their supply safely.
And how long does it take for the results to come back once they're testing?
It depends on the substance.
Okay.
So it's on here. Let me see if it tells you on this.
A couple minutes, right? If my memory serves me correctly.
Yeah, it does take a couple minutes. Well, it says hold the blue end of your test strip and dip it into the water for 15 seconds. And then you have to wait a full 2 minutes until the lines appear. And that's for fentanyl. I'm not sure if it's the same for xylazine, but this one just gives the instructions on fentanyl. It does show on this sheet, though, for meth and MDMA, though. So
Okay.
Right there, how it shows you how to test for it there. Putting it into a larger glass
Okay. Thank
versus
you.
those little cups.
Thank you. Thank you for sharing that. I'd like to move right along. So let me ask, why are supplies like naloxone, fentanyl testing strips, xylazine test strips, and syringe services important? Why do you feel they're important, Carolyn? Let's start with you.
Well, first of all, because of the effect of how it does save lives, it reduces the risk of catching infections, like when you're using someone else's syringe. Having the tester strips, that reduces the risk when you use those tester strips. It reduces the risk of you coming in contact with some fentanyl lace or xylazine lace drugs, which is also a lifesaver. Also, I believe the Narcan, that definitely is a lifesaver. It has been proven many times over. And as mentioned before about how scarce it was at one time, now that the demand has become so great and enormous for it in the community, and it's a great thing that we have major access to it now.
I agree. Thank you so much, Carolyn, for sharing that. What challenges do people who use drugs face here in Milwaukee County?
I think what I'm seeing a lot of is obviously the stigma's huge still. There's still a very large, I don't know that we feel it as much because we work so closely in communities where like that's what we do. So like we don't stigmatize. We've been there before, number one. Number two, like we all are very dedicated to meeting people where they're at, understanding like there are people who choose to use drugs and that's okay. We want to keep them alive as well, just as much as we want to keep the person that's working on their recovery. However, in the community at large, all you have to do is hop on a news article about, recovery programming going out into the suburbs or even in certain neighborhoods in the city, you're going to see a ton of comments of stigmatization of people who use drugs or people who are, and so oftentimes, like that gap between like, hey, don't you feel like you need to give someone a second chance? Like I hope, I've often said like, I hope there's never a time in your life that you have to either get a second chance from somebody or give someone a second chance. And that's why harm reduction is so important, because who are we to say when the next time that person is going to be able to, live a productive life. And again, it doesn't matter like what their choice is as far as using, if they use drugs recreationally, if they are, experiencing having, troubles or concerns with using them, and as far as the addiction part of it goes, or if they're choosing on working in recovery, like who are we to say like what the importance or level of that is as far as people getting a second chance or being able to live, in other words. So I feel like that stigmatization is still something where there's a gap. And then just really being able to reach the people that are most comfortable being talked to. Sometimes people are fearful if they're, living in certain areas where if somebody like myself comes up or any of us comes up, it's like we're seen to be known that we're there for a reason. And then that trust level of trusting somebody who's like perceived as potentially authority or somebody that would tell them that they have to like stop the way they're living. That can create resistance, and that's a difficult thing then to reach people.
I agree. Thank you for that, Connie. I think that was one of the pivotal reasons why Samad's House created the ambassadorship program, because these are women who have lived experience like myself and like pretty much everyone around us, right? Who can go into the community as credible messengers. I know there's been a number of times that we were doing the community collective out, and everyone, Caroline, they call her Cece. Everyone knows Cece. And so Cece was able to reach people that knew her and perceived her as a credible person. So they were willing to listen and be more apt to take the resources, because they were like, oh no, I don't use drugs. And it's like, well, it's not about you using drugs. It's about that you can save someone's life if you were just walking down the street. But then they'll walk down further to collective and see Cece. Oh, Cece, what's going on? Where you been? And she's like, oh yeah, I've been in treatment. And then that conversation happens, and Cece's able to actually get them to take the naloxone, and I think that's quite amazing to be able to have someone as a credible messenger to say, hey, we're not here to judge. We're not here to judge. We've lost way too many people, right? We've lost way too many people, and we feel it's our job just to be able to save some lives.
Yeah. And I would just agree with Connie was saying. We were asked by our state opioid treatment authority to come into the state of Wisconsin and open up a 24/7 opiate treatment program over 10 years ago. And it took us 8 years to get an approval for 2 inner city Milwaukee clinics to open. 8 years because of the stigma that's attached to people who use substances, right? And for us, it's treating these individuals as individuals, right? It enrages me that we care. And I love animals. I have animals. I'm not trying to say animals. Let's not advocate for animals. But we care more about a stray dog posting it on Facebook that this is the dog, this is where I found it, help me find its owner, which I'm very, very grateful for, right? Because if that ever happened to me, that's where I'm going to go to see who spotted my dog. But when we have these unhoused folks living in the streets, you don't see anyone advocating and helping. When you see somebody out having, a psychotic episode on the street, people are posting, oh, look at this guy, and not posting nice things, right? Why not go up to that guy and say, hey, what can I do to help you, right? Like, that's how we reduce stigma. That's how we get people into treatment. That's how we help people get better, and it's treating them like a human. They already don't feel like like they're worth anything, right? So it's just giving them a little bit of hope. And if you're listening to this, you are worthy. You are worthy of saving. There is hope. There are people out there who want to help you. And I don't care if it's your 21st attempt at treatment. You can still get sober. I don't care if you're 65 or 88 years old. There is still hope for you. There is still room for you, and
That's
we'll
right.
meet you where you're at. That's what we're here for.
I love that. Oh, I love that, Amanda. You just gave me chills because it's so true.
Mm-hmm.
I'm not the biggest social media person. Maybe I'm telling my age, but last night I was up a while because a gentleman, and I know we've all seen the gentleman doing outreach on Ninth and Atkinson. He lost his life to a hit and run accident.
Yeah.
And, the one thing that I saw was that there were so many assumptions being
Mm-hmm.
made
Mm-hmm.
behind his death. And it's
Mm-hmm.
so unfortunate. It goes back to the stigma. It goes back
Yeah.
to why people choose to just live in their own bubble because they
Yeah.
don't want someone to come in and label them,
Yeah, or judge them.
or judge them. That's right. That's right. That's right. So let me ask then, what resources do you feel are still missing in Milwaukee when we're talking about harm reduction?
Girl, housing.
Yes, the number
I'm
one.
sorry, that's at the forefront. I mean, yes,
Mhm.
treatment's always needed, right? We fought to get those treatment centers open in the inner city Milwaukee because that's where the overdoses are happening, right? And people want to go to treatment in the areas that they live, right? And Tahira can't open a million different sober livings, and if she wants to, she needs the funding for that. And with the county cutting $3.8 million in housing, how in the heck are we going to help these people live a sustainable, sober life when we can't give them one of the main life not skills, but hierarchy of needs, right? And like, you need a place to a safe place to lay your head, and with that much money being cut, and next year it's going to be even more.
Oh,
It
don't
gets
say that, please.
angry. It gets me angry and it gets me frustrated because of all the hard work that we're doing. I just hope we don't see a rise of overdoses because now folks don't have that access to housing that they once had. It's
Absolutely.
ridiculous.
It's pushing people back into the same system that they're once trying to recover
Yep.
from. Oh yeah,
Yep.
I agree with that.
Mm-hmm.
Yeah, and not
And you,
just housing like the long term, let's set someone up an apartment, but just like the
Mhm.
temporary needed housing
Yeah.
shelters, if you want to call them, or whatever you want to call it, for people just to use, because then those resources are there, and obviously the trickle effect or the domino effect of resources, someone having access or being exposed to the resources in those spaces. But I mean, any of us on this call, I'm sure, has tried to call for housing for somebody who does not have it, and half the time you don't get called back. There's just not the space.
No.
There's not the space. There is space, but there's not the space that's being used for what it could be used for those purposes.
I agree.
And not the
And there's
money
definitely
anymore.
people that want to work
Yeah.
in those roles, so they could definitely employ people to help with those roles. I believe that for sure. But the space is needed, and I mean, we could go on probably for the rest of the time about that topic, Amanda.
I just really want to reiterate, it is housing. It is, harm reduction. It's also the food disparity. It's so many other issues, including healthcare. There's going to be a huge gap dealing with the healthcare system and Medicaid coming the new year. It's just so many things that we're about to experience, that we are about to experience, that I don't know that everyone is fully aware. We were hit with the housing, and that's major because when you're rebuilding your life, you do have to have somewhere to rebuild it at. But then what about when you're coming into recovery, or even if you're not coming into recovery, you have to have equitable health care, right? You've got to be able to have that health care so you can see the doctors for whatever your need may be, including the, MOUD, you have to have health care for that, right?
Yeah.
Yeah.
So let's think about the cuts. There's cuts that's coming down the road, even dealing with that. So I think that's about to be a huge gap as well.
Mhm.
Why do you feel it's important to have Black and brown leaders shaping harm reduction programs?
Because people want to see their people in these roles, right? They don't want to hear it from, and this is no offense to, the white folks, but they want to hear it from the people that they look like. They want to look in the mirror and say, okay, that's my people telling me I'm going to die if I don't start taking naloxone, or I don't start using safely and use all these sterile syringes or pipes or whatever it is that we're given, right? It helps us make a better impact on the population that we're serving.
Okay, I agree with that. And also, what I will add to that would be that people are able to relate and be like, oh, my
Mm-hmm.
people do
Mm-hmm.
care about me. They do
Mm-hmm.
see me. They do
Mm-hmm.
want me to heal. Or one thing that was so pivotal for me was to be able to see someone like myself go
Mm-hmm.
through what I've been through or I'm going
Mm-hmm.
through, to be able to say, I can do it too.
Yeah. We can recover.
We can recover.
I think there's also so many different things in regards to like cultural differences and
Mm-hmm.
understanding and feeling like, whether it's language or
Mm-hmm.
family, traditions or family makeups and how families perceive our family members who use or have used or have substance use, disorders or concerns. There's something to be said about like talking to somebody who understands like, oh, this is my family dynamic. This is how my family feels about this situation, or this is where I come from in the background, and all the times, whether black, brown, whatever, there's the differences in the family dynamic and cultural norms. And so having somebody come in that, even though we may not have, for me, I didn't grow up in the city of Milwaukee, but coming in and having some of those experiences just within my family alone, I'm able to connect with people, or they might be open to me because they know I'm probably a little more likely to know somebody that will relate to them better. And if you're open to like saying that, like, I admit I'm not the perfect person just because I'm in recovery to connect with someone in recovery and be able to help guide them or support them through their way. But I can sure tell you that I'm going to try to find or probably know someone that is more, more appropriate or more a better choice, a better fit to help guide you. Another one I was just going to say is language that I've come across doing this work now is a lot of the things that is put out, like wording I've found, and this is something that I never thought of either until it was brought to my attention, is like wording on a sign. That doesn't translate exactly in Spanish, or Hmong, or the different languages that Milwaukee is full of.
The takeaway that we want our audience to get today is that it's so important for us to become allies on the Midwest regional level for Black and brown communities, because although there's a decrease in overdose deaths, it doesn't hold true in our communities, in our Black and brown communities. So what policies do you feel should shape, what policies will help save the lives in our community? What do you feel?
Well, where do we start? Right?
Yeah,
Right now, we're seeing less of our immigrants coming into treatment, right? Because they're fearful that they're going to be sent back. And, knocking on those doors of somebody that is undocumented, right? That they're not answering their doors. And so that would be like, how do we change that when our current president wants to send everybody back, So it's not, with the three of us on here, we're not going to let that stop us, right? We're still going to try to find a way, and we're going to tell them that, you know what, these programs are safe. This housing is safe. These people are safe, and letting them know that they have somebody in their corner to call. Like, here's our phone number. Give us a call, But that's the first thing that stands out to me, right? And Black and brown people are more likely to be charged of have more drug charges, right? That's why we're in, if you look at the statistics, that's why we're locked up. We're not locked up for big crimes. I mean, yes, there's a percentage of us, but we're very low percentage on there, right? The majority of us are in jail for something that involves drugs.
I had a conversation the other day with the Hispanic and Latino Behavioral Health Center of Excellence. It's a national organization, and they help different states with supporting them through changing policy. And so we were talking about some of the gaps, specifically in peer support. And so I think peer support can be related not just to recovery and mental health, but like there's folks in, peer support programs that are also practicing harm reduction for whatever reason, because as we know, sometimes that's like, leads us to the recovery or whatever the choices are. And one of the gaps that I was telling them about is not just the language gaps but it's the training. It's the actual training of the people that are qualified to do this job best. They don't have college degrees quite often, like statistically. Statistically, they don't have computer skills statistically, and some of the best peer support people have been incarcerated for much of their adult life. So they don't, for silly drug reasons, and they don't have that ability that you need because of the requirements of the state, that the hoops that have to be jumped through in order to become this person that is best fit for this position to guide people in the community that they'll be most comfortable with. They don't have the time, the money, so policy on that, I feel like if that was changed, whereas the training was more friendly for people who don't necessarily have that professional experience. All three of us on here, even through our challenges, we're blessed enough to be able to have professional jobs where we had to learn the computer, we had to learn those job skills. And people in peer support, a lot of the best ones didn't have that privilege. And so I'm finding that more and more as having this peer support position and being overseen and hiring people and trying to bring people on, that's one of the biggest things that we lack is the time to be able to train for the systems that are required by the states in order to actually get reimbursed for this role. And who has time to do it for free? Not me.
Thank you guys for that. I'd like to end with one last question. And I really appreciate your time for coming to speak on Voices of the Front Lines, because as you know, we all do this frontline work and you guys have been rocking at it for so many years. But if you could speak directly,
Yeah,
Amanda, if you could speak directly to lawmakers and policymakers, what would you ask them to change? Let's say it in 3 words.
Change your thinking. That would be my 3 words. Change your thinking.
Change your thinking around harm reduction. Add to it, Connie.
yes.
Connie, add to it. Change your thinking.
Encouraging harm reduction.
There you go.
Encourage harm reduction. And harm reduction is a culmination of many things. We stand firm in naloxone, xylazine testing strips, fentanyl testing strips, gun locks, food, providing food, equitable health care. What else do we have, guys? What else does harm reduction look like to you?
Saving lives, decreasing infection.
Giving a person a chance at life.
Wound care costs, right?
Yeah,
Mm-hmm. Mm-hmm.
for sure.
Yeah.
Yeah.
Compassion.
Mm-hmm.
Harm reduction is compassion.
Harm reduction is hope.
Compassion. It's hope. It's saving lives.
Mm-hmm.
So I want to thank you all for coming today and participating. And I'm really excited about this. And I can't wait to do podcast Voices from the Front Lines, Take 3.
Oh,
I
yes.
look forward to talking to you guys again. I think it will be such a monumental podcast because we are on the brisk of change, right?
Mm-hmm.
And the last thing I want to end with is get out and vote, because that's the
Yes.
only way we can change policies here in Wisconsin. You know,
Yep.
with us being a swing state, get out and vote
Yep.
often. So thank you guys for coming today. Bye-bye.
Voices of the Front Lines is a Samad's House podcast production. It's hosted by Tahira Malik, executive produced by Frisbee and Associates, produced by CFM Media. Follow, subscribe, and listen everywhere podcasts are available.